Greetings from IIDL and APCM. Today with us we have Dr. Geeta Joshi, who has done her MD, DA and PGD HHM. She is Director of International Institute of Distance Learning as well as Course Director. She is Chief Executive Officer of Community Oncology Center, Gujarat Cancer Society at Ahmedabad. She was formerly Deputy Director, Professor and Head in Department of Palliative Medicine, Gujarat Cancer and Research Institute, Ahmedabad. She has several publications and presentations to her credit. She is a national faculty for pain and palliative care trainings and conferences since last 25 years. She has 50 research papers which include 3 book chapters and co-author for a book on cancer. She has held various posts in various organizations such as Director of International Institute of Distance Learning, NAPCAM, and President of Gujarat Chapter. She is National Faculty and member of Governing Council of Indian Association of Palliative Care. She is past Secretary and past President, Indian Society for the Study of Pain. She is past President of South Asian Regional Pain Society. And she is trustee and founder member of NGO Unnat. She has several awards and recognitions to her credit, which include she started Department of Palliative Medicine at Gujarat Cancer and Research Institute, first in Gujarat, with post-graduation in the subject. She has Excellence Award in 2016 for Best Talent to Start New Subject by Gujarat University. And she received the SAARC Countries Award for Excellence and Leadership in Palliative Care given by Cancer Aid Society for the year 2017 and 2018. I would request Dr. Geeta Joshi to tell us briefly about the course.
Thank you, Dr. Piyush Gupta, for kind words of introduction. I am going to give you overview about the Foundation Certificate course in Palliative Care, which is a joint venture of NPTEL and International Institute of Distance Learning, NAPCAM. The NAPCAM aims to alleviate the sufferings of the patient through integration of modern medicine with Ayush. Training of healthcare professionals of both the streams, along with supporting volunteers, social workers and nurses is the utmost importance. Hence, we started the unique upgradable distance learning courses. The first step of which is Foundation course in Palliative Care for one and all under the banner of International Institute of Distance Learning, a unit of NAPCAM in October 2020. It aims to bring together the palliative care practices prevailing in Ayush and allopathy, thus establishing integration between these two streams of medicines. During COVID pandemic, online training was only feasible. So after the birth of NAPCM, we took up these various training programs under the NAPCAM. Taking advantage of technology, the whole training is planned online and distance learning through a web portal. Though it is an online program, there is an ample opportunity for one-to-one interaction with the faculty through distance learning. We have galaxy of experts and faculties in pain management, palliative care and Ayush on our panel. So this foundation course, a certificate course in palliative care under NPTEL, that is National Program on Technology Enhanced Learning, was accepted of our proposal, and thus we started Foundation Certificate course in Palliative Care of 3 months duration, having 12 sessions and 1 session per week. This course will commence in the month of January 2023. Who can do this course? Anyone with the attitude to learn and practice palliative care can apply for this course. How it is beneficial to you? Palliative care is an integral part of any clinical practice. It is a multidisciplinary stream requiring coordination and support from not only specialists but also social workers, volunteers, nurses, and alternate medicine therapists. Hence, learning palliative care widens your scope of practice wherever you are. The duration of the course is 12 weeks. You will be studying one session per week, which are distributed, sessions are distributed in 4 modules, and there are total 12 sessions. The 4 module has the subjects shown in the slide. First module is Introduction of the Palliative Care. Second module is Introduction to Pain, Pain Assessment and Nursing Care. Module 3 is on communication skill and psychological aspects in palliative care, and module 4 is on community based palliative care services. Session 1 in module 1 is what is palliative care. In week 2 you will be studying the introduction to allopathy and Ayush. In week 3 you will be studying practices of palliative care, and in week 4 you will be studying the integrating allopathy and Ayush. Coming to module 2, which is Introduction to Pain, Patient Assessment and Nursing Care. In week 5 you will be studying what is pain. In week 6 you will be studying nursing care and patient assessment. In module 3, which is on communication and psychological aspects in palliative care, in week 7 you will be studying communication skills. In week 8 you will be studying communication in palliative care. In week 9 you will be studying psychological aspect in palliative care, and in week 10 you will be studying care of dying patient. The last is module 4, which is on community based palliative care. In this there are 2 sessions. In week 11 you will be studying community based palliative care, and in week 12 you will be studying models of community participation which are prevalent in India. There are many other courses which are run by International Institutes of Distance Learning under the NAPCAM. And first of all, we started with the certificate course in palliative care, which is of 3 months duration. Another course came up is fellowship in palliative care, which is of duration 6 months. Then we came up with the postgraduate diploma in palliative care of 1 year duration, and we have master's course in palliative care of 1 year duration. The most important thing about these courses are they are online, distance learning, and all these courses are upgradable. There is a scope for hands-on training also if one wants to undergo that training. We have one unique program, that is Palliative Nursing Aid Certificate Program, in collaboration with Courses, the Hospice and NAPCM. I am happy to introduce you a very important member of our team of IIDL NAPCAM, Dr. Piyush Gupta. He is a SPOC of International Institute of Distance Learning. He is Secretary of Cancer Aid Society India and Vice President of Cancer Aid Society India, Society in USA. He is Secretary of National Association of Palliative Care for Ayush and Integrative Medicine, and he is Member Secretary of Cancer Aid Society Ethics Committee. He is recipient of Jewel of India Award. He has various degrees on his feather. He is like postgraduate diploma in rural
Industrial Relations and Personal Management.
And he is a MA LLB and with fellowship in palliative care, fellow of National Cancer Institute USA with PhD degree. He has done various master courses in law, cancer control, palliative care, and many other subjects. He is affiliated with United Nations as a CEO representative, Cancer Aid Society at Economic and Social Council, New York, Geneva, Vienna, and United Nations Department of Global Communications, New York. He is executive board member, Framework Convention Alliance, Switzerland. He is executive board member at Fight Cancer Global, USA. He is executive board member at International Association of Oncology and executive board member of Student Association of Palliative Care. He is executive board member of Mobile Tele-Oncology Project, Sanjay Gandhi PG Institute of Medical Sciences, Lucknow, and member committee for amendment of NDPS Act and rules with Ministry of Finance, Government of India. He is member Health Partner Forum Technical Support Group, National Health Mission, Government of UP. He has about 100 copyright documents, including a series of 25 booklets on different cancers. He is involved in clinical trials in 2020 using homeopathic combination in prophylaxis of viral fever COVID-19 conducted on 17,000 data sample. In 2021, using homeopathic combination in treatment of fever and respiratory distress due to COVID-19. And in 2022, using homeopathic combinations for the treatment of musculoskeletal pain. And he looks after our that web portal for various distance learning courses. Thank you.
Thank you, Geeta ji. I hope that Geeta ji has given us enlightenment about the distance learning courses in palliative care. This foundation certificate course in palliative care shall be first of its type, not only on NPTEL but entire country. Palliative care, Geeta ji, I would like you to just say in 2 lines what palliative care is, because most of our audience is not aware about this term. This term may be new for them.
Yeah, that is true. There is a very much lack of awareness about this word palliative care itself. And palliative care is a holistic care given to the patients who are suffering from life-limiting illnesses like cancer, HIV/AIDS, paraplegia, some neurological disorder, kidney failure, liver failure, etc. And it is given by evaluating their physical, psychological, social, spiritual and financial problem and trying to improve, help them with this problem. And overall aim of this palliative care is to improve quality of life of the patient and caregiver and their family.
So what I believe is that, Geeta ji, this course is not only useful for medical professionals, but it is useful for all sort of people, including housewives.
Yes, palliative care is given by a teamwork. A multidisciplinary team is required to deliver the palliative care to these patients. And this team includes not only doctors, nurses, volunteers, paramedics, social worker, psychologist, counselor and many more. That is why this course is helpful to anybody who wants to work in this field, and they can contribute immensely even if they are not doctors or paramedics.
Thank you, Geeta ji. What I believe is that 60% of all people are right now suffering in some pain or the other. To cut short, palliative care professionals also target to treat this pain, because many a times you suffer in this pain for several years. So Geeta ji, can you just say a few words about that?
Yeah. In giving palliative care, the first thing we have to alleviate suffering, that is physical pain. So in physical problems, patient might be having severe pain and very many distressing symptoms. Coming to pain, many of the patients are suffering from chronic pain. for particularly cancer patients who got suffering from cancer pain, which is moderate to severe. And we, being a palliative care specialist, we are expert in managing pain as such, and particularly chronic pain.
So, dear friends, if you are having anyone who is suffering from pain for several years or several months, I think palliative care professionals are the right people whom you should go, and they'll take away your pain, because it may be emotional pain or physical pain or mental pain. Palliative care professionals are having the art to address all the pains with all the patients.
Yeah, you rightly said that pain doesn't have only physical component. It has got a emotional component, psychological component, social component, spiritual component, and palliative care physician is the and team is the only people who takes care of all these components and treating patient as a whole. And this type of pain is called total pain, which requires holistic approach and a teamwork to relieve their suffering. And that is what our palliative care team can do for the patient.
So, the magic of palliative care professionals is that the same medicine which may not be relieving your pain may start relieving your pain, because they have treated your mental pain as well as emotional pain also. Thank you. And I think this course is going to give you immense learning knowledge, not only for yourself, but you will be able to support the entire community. Have a great course ahead.
Thank you.